Welcome back. In this video, we'll be talking about the appropriate duration of symptoms required for a diagnosis of depression. One of the key elements in diagnosing depression, whether using the ICD-10 or MH-GAP criteria, is the duration of the symptoms. Understanding this criterion helps distinguish between temporary sadness or stress and a clinical diagnosis of depression that requires professional intervention. So, why is duration important? When we experience difficult or upsetting events, it's normal to feel sad, anxious, or overwhelmed for a short period of time. For example, after the loss of a loved one, a breakup, or a major life change, it's natural to feel down or even hopeless for a time. However, these emotions are usually temporary and often improve as we adjust to the situation. That's where the duration of symptoms becomes crucial. For depression to be diagnosed, the symptoms must be persistent. They cannot simply be reactions to a life event or stressors that last for a few days or even a week. According to diagnostic criteria like the ICD-10 and MH-GAP, depression is typically diagnosed when the symptoms have lasted for at least 2 weeks or longer. The 2-week minimum duration. The 2-week period is significant because it allows clinicians to differentiate clinical depression from temporary emotional distress. If someone has been feeling down for a couple of days after a challenging event, it might not meet the criteria for depression. However, if those feelings persist beyond 2 weeks and begin to impair their ability to function in daily life, it may indicate that the person is dealing with clinical depression. What happens after the 2 weeks? Once the 2-week mark has passed, it's essential to assess how these symptoms are affecting the individual's functionality. Is the person able to go to work or school? Are they able to take care of themselves, like eating, grooming, and maintaining relationships? If depression is severe enough to interfere with basic daily activities, then it's a sign that the condition requires treatment. Sometimes, depression can last much longer than the minimum required duration. It can become chronic depression, where the symptoms persist for months or even years. Chronic depression can make it incredibly difficult for individuals to experience a sense of relief or joy, affecting their long-term mental health and quality of life. Early diagnosis and treatment are crucial in preventing depression from becoming chronic. Duration and symptom severity. The duration of symptoms is important, but so is the severity of those symptoms. It's one thing to feel sad or have a few sleepless nights, but if the sadness is overwhelming, persistent, and significantly impacts the person's ability to function, this is a clear sign of depression. The ICD-10 criteria and MH-GAP diagnostic criteria both consider severity alongside duration to ensure that the diagnosis accurately reflects the impact of the condition. For example, if someone has experienced feelings of sadness or hopelessness for more than 2 weeks, but these feelings haven't impaired their ability to maintain relationships or perform tasks, it might indicate mild depression. On the other hand, if someone has been feeling hopeless and worthless for 2 weeks or longer, and it is affecting their ability to go to work, care for themselves, or engage socially, this could be moderate to severe depression. In these cases, the severity of the symptoms warrants more immediate attention and intervention. Reflection questions. Why do you think the 2-week duration of symptoms is important in diagnosing depression? How do you think a person's daily functioning is impacted when they experience depression for 2 weeks or longer? How does the severity of symptoms play a role in determining the type of depression a person may have? When to seek help? So, how do we know when someone should seek help? The answer is simple. If the symptoms last for 2 weeks or longer and are interfering with their ability to function normally, it's time to consult a healthcare provider. Early intervention is key to preventing depression from worsening or becoming chronic. The sooner a person receives help, the better the chances are for recovery and managing the symptoms effectively. It's also important to note that depression is not always triggered by an obvious event. Sometimes, people can experience depression without a clear cause. and it can be biologically or genetically driven. This means that a person might not have any significant life stresses, yet they still experience persistent sadness and loss of interest. For instance, some individuals may have a family history of depression or may have experienced depression in the past, making them more vulnerable to future episodes. In these cases, recognizing the duration and severity of symptoms can help clinicians identify early signs and provide preventive care before the depression worsens. Treatment after 2 weeks. Once the 2-week period has passed, the treatment process often begins. If depression is diagnosed after a 2-week period of persistent symptoms, a combination of therapy and medication may be recommended. Cognitive behavioral therapy, CBT, antidepressant medications, and lifestyle changes, such as regular exercise and improved sleep hygiene, are common methods for managing depression. For severe or chronic depression, long-term treatment may be necessary, often involving a combination of medication and regular therapy sessions. The goal of treatment is to help individuals regain functionality, reduce the severity of their symptoms, and ultimately help them return to their normal routine. Reflection questions. What do you think the benefits are of seeking help early, especially after 2 weeks of persistent symptoms? How might treatment change if someone has experienced depression for several months or years versus just a couple of weeks? To summarize, the 2-week duration is crucial in diagnosing depression, as it helps differentiate between normal sadness and clinical depression. This duration allows healthcare providers to determine whether the symptoms are temporary or whether they are part of a larger mental health issue that requires intervention. In the next video, we'll explore the functional impairment caused by depression and how it affects personal care, relationships, work, and social participation. Let's keep it going, and I'll see you in the next one.